Alex Chemerov here at Movements for Life. For today's restorative segment, we're going to continue our cage work, our cage mobility in the true stretch. So for today, we're going to piggyback off of last week's anterior hip stretch, and we're going to get more into a kneeling hip flexor stretch, which is going to get a little bit more into the rec fem. So the rectus femoris, the only quad muscle that's also a hip flexor. So it's going to be influenced by both knee and hip motion. Now, just referencing earlier videos, remember, no muscle is an island, so even though this one's really going to kind of pick on that rec fem a little bit more, doesn't mean that I cannot or I'm not influencing other tissues within my anterior hip. So kneeling hip flexor stretch, I'm sure many of you have done it on the ground. You could also elevate your foot. The significance of that is, remember, the rec fem does cross the hip and the knee joint, so if I flex my knee, I'm now forcing more load or stretch from the knee before I even do anything at the hip. So then if I start driving my pelvis, if you can envision the tug of war that's going to take place as it's really being pulled from both ends, it's going to really make things so much more aggressive. So the amount of knee flexion is going to be really pertinent here. So very often we start, especially if somebody's very restricted through the anterior hip, through the rec fem, we will start keeping that back foot down as it relates to the true stretch or anywhere. And all we want to start doing is, before I start driving my hip forward, I want to make sure that I can get through a posterior tilt, right? Because if I do a posterior tilt, that's going to stretch my anterior hip. If I'm driving my pelvis forward and my knee forward on my right side, and I bail out through my lumbar spine, I'm going into lumbar extension, well, I'm really not maximally loading or stretching these tissues. So what we like to do to teach this motion first is just keep everything stacked, hip right over the knee, about 90-degree angle in my opposite leg. And now from here, can I go through a posterior tilt and create load and stretch on that anterior hip while keeping my chest tall, right? If I dip into an abdominal crunch, that's another bailout, right? So I want to stay tall through my T-spine. Can I just tuck my pelvis underneath? Can I do that posterior tilt? That's going to get some nice load and stretch onto that anterior hip. Once I can do so successfully without compensatory patterns, well, now I can elevate my back leg, increase the demand on that rec fem from the knee end of things, and now I could do the same thing, right? Can I start driving that posterior tilt? So that's going to really aggressively get to that rec fem. Once I do that, I can stay tucked, and now from here I can start getting a little bit of a hip drive. I don't have to go too aggressive because it doesn't take much, as long as I can stay in that posterior tilt and not bail out and go into that lumbar extension, right? So that anterior tilt. So keep things tucked, and then from there, you can let the beauty of the true stretch do its work, where I can now get a little bit more transverse plane influence with my upper body by pre-positioning my hands in right rotation. I can get more into that frontal plane. So I have so many different options I can play around with here, depending on who I am and what I have going on. You know, so I can change the position of this foot. If I take my right foot and move it to the right a little bit more of a frontal plane tweak with my footprint, I can now start driving into that rec fem and getting a little bit more of adductor complex involved. So I'm essentially driving that pelvis to the right, getting some nice abduction going on with that left hip. Or I can cross over the opposite way to my opposite side lateral, and I could drive my pelvis forward to the left, and that's going to now start getting into that lateral complex. So start getting a little TFL and down that IT band. So awesome versatile tool, as long as you can understand what tissues you want to go after, and more importantly, how to do it. You should be able to replicate anything that your body needs. Don't just do just for the sake of doing it. Do what your body needs, especially from a mobility standpoint. So I hope that was helpful for you as it relates to the rec fem. You can apply these principles if you don't have a true stretch. Right? If I'm on the ground doing this, if you're at home, we have a lot of our clients do their home program like this. Put the foot up on the couch so it's nice and soft, and I can do the same thing. Right? If I have nothing to hold on to, I can drive my arms actively so I can get a nice active stretch. Again, all three planes, I can get into my transverse plane and also into that frontal plane. So just apply the same thing here. About 90-90 both knees, nice hip tuck, and All that load and stretch is going to go into that anterior hip. It's going to get a little quadsier because of that knee flexion. So enjoy. Thanks so much for watching, and we'll see you guys next week.